Good morning. This is Racial Health Disparities in Infant and Maternal Mortality Morbidity Rates. My name is Lakeisha Glaspie. Let's begin. This assignment requires one policy area that is of personal interest. I'd like to present on a state policy named First Year Cape Fear. Though this is presented as a state policy, it stems from a local initiative that I helped to form a few years ago. When the data from a community health assessment revealed the racial disparities related to infant and maternal health, the Infant Mortality and Maternal Health Task Force was formed. Shortly thereafter, subcommittees were also formed to target certain areas. I received an invitation to this task force and a subcommittee because of my work in the early childhood community and in public health. We established First Year Cape Fear in 2020. First Year Cape Fear is a collaborative of local public health professionals, birth workers, healthcare providers, and community organizations. Many of the strategies and interventions discussed in this presentation came from our collaborative as we began the work to eliminate disparities in New Hanover, Pender, and Columbus counties. Infant mortality is the death of an infant within the first year of life. The infant mortality rate is the number of infant deaths per every 1,000 live births. Infant mortality rates can give valuable information on maternal and infant health, an indicator of the overall health of the community. Morbidity refers to illness or disease, which can contribute to infant mortality. A birth defect can be found before birth, at birth, or any time after birth. Most birth defects are found within the first year of life. Preterm birth is when a baby is born before 37 weeks of pregnancy have been completed. In 2020, preterm birth affected 1 of every 10 infants born in the United States. Suffocation death rates increased 20% among infants overall, 21% among Black children between 2010 and 2019. Sudden unexpected infant death is a term used to describe the sudden and unexpected death of a baby less than 1 year old, in which the cause was not obvious before investigation. These deaths often happen during sleep or in a baby's sleep area. Maternal pregnancy complications usually include severe maternal morbidity, which includes unexpected outcomes of labor and delivery that result in significant short or long-term consequences to a woman's health. Let's talk about the problem facing our society. We'll start by taking a look at infant mortality rates at national, state, and local levels. For purposes of this presentation, we will limit our focus on racial health disparities to non-Hispanic white and non-Hispanic Black populations. We will also review local data in New Hanover County, which is my local area. African Americans have the highest infant mortality rate of any racial or ethnic group in the United States. At national, state, and local levels, Black and African American groups have the highest infant mortality rates. Nationally, Black and African American infant death rates are more than twice that of white infants. Statewide, Black infant deaths are 2.66 times the rate for white infants, which is one of the widest disparities ever recorded in the state's history. It is more than 12% than the rate was 20 years ago. Ultimately, we want to remove barriers and challenges to improve infant and maternal health, which includes addressing infant and maternal mortality and morbidity rates. There are 3 core components we'll discuss. Each core component represents a goal to help accomplish our mission to improve birth outcomes and eliminate health disparities in the Black community. Advocacy is meant to facilitate research to understand the health and experiences of Black families and better inform community practices. It is important to fund community-based education and communication initiatives to support families. Educating families, practitioners, and institutions on strategies aimed at mitigating those maternal and infant health disparities. By improving access to services, existing health programs are strengthened and more support is given to reproductive health. Pregnant women can be screened and treated who are at risk for preterm birth. African American women who can better navigate the healthcare system if they are given the tools. Clinical improvement happens when healthcare providers are trained to address racism and build a more diverse healthcare workforce, which leads us to bias training. Implicit bias training is a strategy to address the impacts of racism on birth outcomes. This intervention strategy can have a direct influence on the infrastructure of infant and maternal health services. Disparities in maternal and infant mortality are rooted in racism. Structural racism in healthcare and social services often means that the quality of care African American women receive is of lesser quality than their white counterparts. The local example of this intervention strategy has been the everyday bias training that has been offered at little to no cost to healthcare and social service providers throughout the Cape Fear area, courtesy of CHEC. Although racism drives racial disparities in maternal and infant mortality, there are other contributing factors to consider. Lack of funding for family support and healthcare programs contribute to the disparities in infant and maternal health, including mental health. For example, providing access to early intervention services that have a comprehensive approach for maternal and infant mental health by providing better family supports before and after birth. Family economic security is also improved. For example, simplify the enrollment across the public benefit programs, such as nutrition programs like WIC, the Women, Infants, and Children program, which is federally funded, and expand Medicaid. Locally in New Hanover County, the doula program has expanded. This program allows mothers to have more options for their birth plans. In the past, doulas have been in short supply, even though the demand has been high. Finding doulas that are also women of color has proven difficult. The recent expansion program has been a step in the right direction to eliminate this barrier. Lastly, data-driven policies typically have mandated oversight. In conclusion, state legislators have a unique opportunity to balance resources and state laws. Legislators can secure the funding for investments and public supports. Evidence-based, data-driven policies ensure that families can be healthier families, and improving these birth outcomes statewide for underserved, vulnerable communities is the first step toward a healthier future. Thank you so much, and have a wonderful day.